This is my case study final on osteoporosis. So the patient history, background, and symptoms. She is Marissa, a petite Caucasian 15-year-old, and she's been living with her 55-year-old grandmother ever since her parents died in a car accident. And her grandmother was recently diagnosed with osteoporosis. Her symptoms include chronic hip and wrist pain. About osteoporosis. Osteoporosis is a bone disease that weakens bones. It means porous bones because the bones become more porous and weak, and they're more prone to unexpected fractures. It makes bones weak and brittle, causing them to be extremely fragile. And since bone is essentially living tissue that is always being broken down and replaced again by the process of bone reconstruction, when the creation of new bone does not keep up, so like when bone reconstruction doesn't like keep going, and it with the loss, like when bones break down, they don't reconstruct as fast, and that is osteoporosis. Women past menopause are also more likely to obtain osteoporosis because of bone remodeling as well. After menopause, the bone breakdown occurs more quickly. So with osteoporosis, you lose bone at a greater rate, and menopause makes you more prone to it. And also, people with low bone density are at risk for gaining osteoporosis. The symptoms of osteoporosis include loss of height, bent over or a stooped posture, bone fractures or easily broken bones, back or lumbar pain, and shortness of breath due to the less lung space or capacity because of posture, and the compressed back discs because of the posture. And then we have risk factors and causes. The risk for osteoporosis becomes more prevalent with age. People with already low bone density can become more at risk because it is the breakdown of bones. And postmenopause or women over 50. And it's also more prone to women as well than it is to men. The other causes can be lifestyle choices, family history, and petite or small body frames. So Marissa, as stated, is a petite Caucasian 15-year-old, and her ethnicity makes it more prone to her, as well as her petite frame. Prevention of osteoporosis can include a healthy diet and lifestyle choices. Eating more or absorbing more vitamin D or enough vitamin D so you cannot get osteoporosis. Avoiding smoking and drinking alcohol, limit of caffeine, and absorbing or eating foods rich with calcium for your bones. Treatment can include various options, being hormone therapy, mineral and vitamin supplements, increase of exercise, and differing medications like shots that usually are once a year or twice a year. I forgot, I read about it, but I put it in the slides. That can be treatment options. And the anatomy of the affected area is Marissa's grandma reported hip and wrist pains, common in areas for osteoporosis.